My name is Hanke de Kok, and I've been part of the Boost Collaborative for the past 7 months. Yeah, I just would like to thank all my team, especially you, Angie, with helping me always with slides and talking points. And this is a very relatively new field for me as well. I mean, I'm not a data guy, and I learned a lot. So let's just talk about the Boost journey. So yeah, today we'll briefly just review the background of Boost, what problem we're trying to address, the science, the quality improvement journey, the accomplishments, and the future opportunities. As we all know, the problem is complex, even more complex with the toxic drug supply. And then we're looking at the poor attention in care and treatment. This is updated to the most recent data from the coroner's report. Something to take out of here, there's 6 deaths per day in British Columbia and roughly about 1 death per day in interior health. And then also important to know that for every fatal overdose, there are approximately 25 to 50 non-fatal near-miss events. If we look at the illicit drug toxicity deaths by health authority, in the past 10 years, the number of deaths and deaths rates are 10 times higher than previous years. If you look at interior health from 2012 to 2022, the numbers are quite staggering. If you look at the drug types relevant to death, predominantly this is driven by fentanyl. If you look at the blue line, and then in recent year, if you look at the orange line, benzodiazepines has become a concern as well. So the gaps in our system, specifically retention rates are going down and people are not receiving optimal doses. If you look at 53% of patients receiving stabilization doses of methadone above 60 milligrams, that's down 4% since 2010. And then 45% of people started on methadone retained at 6 months, that's down 8%. And 33% of people started on methadone at 12 months, that's 10% down since 2010. Furthermore, the retention gap in British Columbia, 24.5% of those in need of care retained at 12 months, and in interior health, 22% of those in need of care retained at 12 months. We know the issue is complex and there are many factors, including the ones that listed above. If you look at medication adherence, there's a lot of patient factors. And then on top of that, you have the health system factors as well as provider factors. This is just a further look at barriers to medication adherence. If you look at the challenges, the meeting the program requirements, it is quite a strict program. Dr. Grover addressed some of these as well. And then there's also the treatment concerns and as well as the access. So let's look at the science behind the effectiveness of opioid agonist therapy. So research strongly suggests that being retained on opioid agonist therapy significantly lowers the mortality risk. if you look at specifically on or off methadone, look at those numbers, 11.36 per 1,000 person years versus off methadone, 36.1, which is quite significant. And if you look at buprenorphine and Suboxone as well, off buprenorphine, much higher. And then even though more research that shows that opiate agonist therapy reduces the risk of mortality even in the presence of fentanyl. Opiate agonist therapy within the context of other interventions, such as withdrawal management, specialist services, and harm reduction. If you look at there, it's withdrawal management, medical, and then you have the opiate agonist therapies, and then the SROM, as well as harm reduction. So knowing all of the above, what can we do about it? As mentioned, it's a big, complex problem. There are many factors that we can't tackle everything at once. We can focus on expanding and improving substance use treatment, and this is essentially what Boost is about. So now let's move over to quality improvement. So the journey, how did we get here? So the BC Centre for Excellence first collaborative was the Stop HIV/AIDS collaborative launched in 2010. This resulted in significant improvements and better health outcomes for people living with HIV in British Columbia. Following the same framework, Boost was launched as a pilot in Vancouver in 2017 in partnership with Vancouver Coastal Health. Due to the success of this pilot, Boost expanded provincially to in 2019. Finally, the Centre for Excellence received extra funding and partnered with Interior Health to deliver a targeted QI collaborative in the Interior region in 2022. So Boost is based on breakthrough series collaborative methodology developed by the Institute for Healthcare Improvement. This is a short learning system that brings together a number of teams from different hospitals or clinics to seek improvement in a focused topic area, in our case, opiate use disorder. It is based on quality improvement approach, specifically the model for improvement framework, which many of you have seen by now. So Boost is data-driven improvement at the front lines. It's also an opportunity for teams to learn from each other and learn from subject matter experts. So the Interior Boost Collaborative launched in June 2020 with 8 teams across from Interior Health. Learning events have included QI training, education, on topics related to opiate use disorder, action planning, and the voices of clients and family. In between learning sessions, teams have been testing changes with the help of the QI coach, and teams have been reporting monthly on their Boost work, including key metrics. So in terms of knowledge gained, we have some data on what we collect from event evaluation. So if you look at the last 3 bullet points, that is info taken from event evaluation summaries average over time. At the first one, 100% agreed, then it was 73, and then again 100% strongly agreed. So over the past 8 months, teams have been testing various change ideas There are some areas of focus identified by all of you. If you look at some of the changes tested, to highlight a few, such as referral forms targeted towards gathering better client contact and location info for intake appointments. There was some of about automated text appointment reminders, as well as trial of delivery medications to targeted clients. So as a reminder, these are the key measures agreed upon at the launch of the collaborative in June. If you look at the core measures, we have the population of focus, the active OAT prescriptions, retention on OAT for longer than 3 months, and the patient voice process. So before the next few slides, it's important to remember the limitations with the BOOST data. That being said, with the QI, we are looking for trends over time, so we don't need perfect data. So if we look at the BOOST core measures, the results to date, the percentage of clients with an active OAT prescription over time. This measure is defined as the number of clients in our population of focus with current OAT prescription that has an end date on the same day or at a later date, regardless of the dose. And there's some fluctuations, but has remained relatively stable with a slight upward trend. Okay, so this is defined as the number of POF population of focus. I always forget that. So with an OAT prescription for an uninterrupted period of 3 months or greater, not all of the population of focus with an active prescription are eligible for retention on OAT for 3 months, as some might not have been on OAT long enough. The denominator for this measure is the number of population of focus with an active OAT prescription whose initial prescription start date is equal to or greater than 3 months. The above data shows fluctuation but relatively stable retention rates from June to December 2022. So if you look at these graphs, in the above graph, that's the baseline data from June 2022 is represented by the gray bars, and the most recent reporting period from December 2022 is represented in the blue. So the population of focus increased from 1,265 clients at baseline to 1,431 at the last reporting period, which is a 13% increase. The number of clients from the population of focus with an active OAT prescription, that's uninterrupted treatment, also increased from 855 to 1121, which is a 31% improvement. And the number of clients on OAT for 3 months or more increased from 475 to 729, and that's 53% improvement. So while the population of focus has increased, retention rates have been sustained. If you look at, again, another key metric is the client and family voice. As you can see here, 50%, half of the participating teams have incorporated the client and family voice into their work as of December 2022, compared to 13% in the beginning. So clearly what we can see here, the teams are on the way to increase engagement of the client and family voice in their work. So if you look at this slide, so each team is given a score on a monthly basis using the Institute for Healthcare Improvement Assessment Score for collaboratives. The score is an indication of the progress of the team, and it looks at the likelihood of sustained changes. The goal is 4.5, which shows sustained improvement in most outcome measures. 75% of goals achieved and then spread to a larger population as begun. The score of 2.5, between 2.5 and 3.5 is an indication that at least some of the changes introduced by the teams are going to be sustainable. So due to the short time intervention of 7 months, we are seeing the score at the lower end of sustainability. So now it's up to the teams to continue the QI journey and refine changes that will lead to better client outcomes. So please note that the scoring is based on team monthly reports and may not reflect all of the work being done and improvements at team level. So what are the accomplishments up to date? We have increased knowledge and confidence in opioid use disorder care, increased quality improvement capacity, enhancement opportunities for collaboration and networking between teams, increase of the number of clients with an active treatment, and the number of clients retained on opiate agonist therapy for 3 months, increased connections to community resources. And then, the enhanced capability for virtual meetings and also a mind shift, and showed us that we can really do QI. So what are the future opportunities? I'm going to focus on integration of QI into daily workflow routine, increase engagement of physicians in Boost QI work, as well as EMR improvements. So we showed you this at the launch in June, and maybe some of you can relate to this now. The reality is not always smooth and many challenges and pitfalls, but we will get there eventually. So in summary, there's always room for improvement. We've made great progress, but there's always room for improvement. And in the biggest room in the world is the room for improvement.